So the thyroid gland, right? All about metabolism, okay? Really important, okay? So people, some of the disorders, people can be hypothyroid, so they're not releasing enough thyroid hormones, so they can gain weight, right? Because their metabolic rate, the way or that they're using energy is lower, and so they're actually gaining weight, right? Hypothyroidism, that could be an issue, and it's easy to diagnose because again, they would take blood, they look at the thyroid hormones, and they could tell, is it low, is it high? Some people are hyperthyroid. What that means is they're making too much thyroid hormone. Again, that's not a good thing, okay? They get jittery, they're using too much of their sugar, and it can actually affect the heart. So both hyper or hypo are not good things. More triiodothyronine, again, have to do with basal metabolic rate. Calcitonin, just like it sounds, calcium, right? Calcitonin, influence, and the target organs, bone, right? Because you know you store calcium in your bone. It says influence bone calcium metabolism, helps maintain plasma calcium homeostasis. Parathyroid, okay, they're little glands behind the thyroid, have to do with calcium and metabolism of phosphorus. Now the pancreas, okay, the biggies, insulin and glucagon. Think of insulin, it helps decrease blood glucose levels. It makes the glucose go into the cells. Glucose is sugar. The cells need sugar for energy, yes? So plays a role in maintenance of normal blood sugar, promotes the entry of glucose into the cells, thereby lowering BG, blood glucose levels. Glucagon does the opposite of insulin. It increases blood sugar levels. So when you're maintaining homeostasis, you're maintaining your blood sugar levels, right? You want to maintain it at a certain level. So if you haven't eaten in a while, right, you're storing glucose in your liver, glucagon would be released, and it helps break down glycogen to glucose. Glycogen's in the liver, it's big chains of glucose, and we're going to release the glucose into the blood. Now your blood sugar levels go up. Somatostatin stimulates the uterus to contract during labor, delivery parturition, stimulates release of milk during suckling. Now, adrenals, they're the glands on top of the kidneys. Cortisol, you may have heard of cortisol, that's a biggie. That has to do with fat metabolism, okay? Regulates carbohydrates, proteins, fat metabolism needed for gluconeogenesis, increase blood sugar levels, provide anti-inflammatory effects, help body cope during stress. So sometimes they talk about cortisol, and they talk about, if people are having issues with that, that can influence body weight. Corticosterone, essential normal use of carbohydrates, absorption of glucose, potassium, sodium metabolism. Aldosterone, that has to do with sodium levels, right? It means nothing to you right now, but it's a big deal when we get into the kidneys, okay? Because the kidneys, their main thing has to do with water homeostasis. You want to keep your water levels at a certain level in your body. Testosterone, major male hormone, right? The adrenal glands, so the testes release testosterone, the adrenals can do too. Influence the development of male secondary sex characteristics, talking about males being taller, bigger bones, bigger muscle, facial hair, thicker skin. That's what we're talking about. Androsterone, so if you think of androgens, influence development of male secondary sex characteristics. More for the adrenal glands, right? There are these tiny little things right on top of the kidneys, really important. Medulla dilates arteries, dopamine, excuse me, dilates systematic arteries, increase cardiac output, increase urinary output. Epinephrine acts as vasoconstrictor. Okay, norepinephrine, vasoconstrictor. Again, these hormones are getting the body for fight or flight. If for whatever reason you're in some kind of situation where you got to go, you need energy to your muscles, you need your heart moving, these hormones are going to be involved. Now, finally, the sex organs, the ovaries, estrogen, progesterone, they all have to do with, there are forms of estrogens, estradiol, estrone, estriol, essential for growth development of female secondary sex characteristics, female sex organs, development of mammary glands, play a vital role in women's emotional well-being and sex drive, right? These are very important in making a female, and not just that, okay? Making breasts, making hips, being able to have babies, right? So it has to do with eggs and egg maturation. Progesterone, really important. If a woman is pregnant, gets that uterus thickening, getting ready for the implantation of the embryo. And then finally, testosterone, right? Made from the testes. Again, this is for male sex organs, male secondary sex characteristics, a vital role in erection, necessary for sexual act copulation. Oh, thymus, okay, that's the one that's here, right in the chest, has to do with immunity, T cell production, thymopoietin, production of lymphocytes, precursor of T cells. Gastrointestinals, we're talking about in the gastric tract. So it's really interesting because you would never think that your intestines have anything to do with endocrine. The intestines, the digestive system is so cool because it's just this tube, yet the cells in the tube can release hormones and they affect digestion, right? Which kind of makes sense. So gastric, gastrocnemius, we're talking about the stomach. Stimulates gastric secretion. Secretin, just like it says, so secretion, stimulates pancreatic juice, bile, intestinal secretion. Cholecystokinin causes contraction, empty gallbladder, right? Because you want that tube to move. You want to release digestive juices into the tube so we can break food down. You want the tube to move, so the cholecystokinin, the secretin. Enterogastrone regulates gastric secretions. All right, so those are just some of the main endocrine organs, hormones, effects, okay? So most of the structures of the glands develop during the first 3 months of pregnancy, endocrine system of newborn by hormones across the placenta. Mom does a lot of work for the baby before the baby's actually born. Both male, female newborns may have swelling of breasts and genitalia from maternal hormones. Sometimes that's really weird. If you've ever seen a newborn, you're like, what the heck, right? Their genitals look really big, but that could be from mom, right? Mom's hormones, mom's pregnant, and hormones are really tiny. So they cross the placental barrier, right? And so they can affect the tissues of the fetus. So totally normal. Pituitary gland, small, okay. All right, some more about pituitary. So we just talked about this, right? Here's a picture, okay? So it helps, again, a picture is worth 1,000 words. You have your table that shows everything. Now, here's a picture that shows everything. So we're in the brain. Here's the hypothalamus. Here's the pituitary. The reason that you're showing blood, because hormones are secreted into the blood, right? Here they are. So TCH, thyroid stimulating, affecting the thyroid glands, thyroid hormones. ACTH, adrenal cord. So it's showing the hormones released by the pituitary. Here's the anterior, and the gland or the target organs it would influence. So again, a picture is worth 1,000 words. Here is the posterior lobe. They're talking about that. Okay. Oh, sorry, pineal. So there's the posterior lobe. Okay. So pineal, talking about that, which we already did. Thyroid, talking about that. But this actually shows you a picture of the thyroid gland, right? Releasing all of those important thyroid hormones. Parathyroids, they're behind, they're posterior to the thyroid. So imagine the neck, this would be the back of the head, right? Here's the trachea. So the thyroid's right there, and behind them are the parathyroid. So remember, that has to do with calcium. Okay. Tetany of the hand, hypoparathyroidism. So again, if there's too much or too little of a hormone, can affect the body. the pancreas, right? So it's actually right on, it's a glandular tissue. If you do dissection, if you take anatomy and you do dissection, it's so easy to ruin this, right? You think it's just fat. You're like, well, let's just get out. You know, it's actually a gland. So it shows, it says endocrine function. Endocrine means it's going into the blood. It shows exocrine function. Exocrine means those hormones or those secretions are going into the digestive tube. Okay. Diabetes, all the issues with diabetes, okay? They're talking about it because of the pancreas, and because the pancreas releases insulin. There are different forms of diabetes. There's type 1 and there's type 2. Type 1, something happens to the pancreas, and the pancreas is not releasing insulin. If the pancreas doesn't release insulin, then the blood sugar levels stay high. If they stay high, the cells can't get the sugar. If the blood sugar stays in the blood, okay, the glucose stays in the blood, the cells can't get the sugar. If the cells can't get the sugar, now they're going to suffer, okay? So it shows type 1, some of the early manifestations, type 2. Type 2 diabetes is blood sugar levels are okay. The cells are, insulin levels are okay. The cells are not responding to the insulin. And that's why blood sugar levels are high. So there are all kinds of issues if the cells can't get their sugar, right? It can affect the nervous system, sensory. You hear about diabetics losing their eyesight, okay? Cardiovascular affects the heart, affects the vasculature. Renal affects the kidneys. You hear about diabetics being on dialysis where their kidneys stop functioning because diabetes can damage the blood vessels, and the kidneys, they are what are filtering the blood, and there's high blood pressure, or if there's high blood pressure at the kidneys, then we can damage the kidneys. And it's a common thing for diabetics to damage their kidneys and to have to go on dialysis. So it says hypertension, albuminuria, edema, chronic renal failure, very scary. Albumin, that's protein in the blood. Immune system, you hear about diabetics having issues with their immune system, having issues with healing, skin infections. Why, right? Again, if we're affecting blood and circulation, it affects so much more. Integumentary, you hear about diabetics losing toes or losing feet. Again, that's an effect. So all kinds of diabetes is a real problem, unfortunately, in our society. And unfortunately, there's type 1, again, and there's type 2. Type 1 is relatively uncommon compared to type 2. Type 2 is the biggie. We see it in our elderly population, but we're seeing it in the young people too, which is horrible. And it is tied to diet and exercise. Having a bad diet full of sugar and fat, exercise, not having enough exercise. So the two, it's like this horrible combination. And it's almost, an epidemic in our society. So they're talking about the pancreas. Okay, so type 1 diabetes, most common endocrine system disorder of childhood. Okay, but again, it's not common in regards to diabetes. So some of the issues that they might have, the symptoms they might have, polyuria, right? That's they're urinating a lot. So what happens is one of the symptoms of diabetes is urinating a lot and being really thirsty. It's like, what's going on? Why are they thirsty? Why are they urinating? What's happening? Their blood glucose levels are high. So it's like there's something called osmolarity, and it's high. So they have a lot of solutes in their blood. And because of that, the brain is trying to regulate it by getting more water. Well, when there's too much water, so that's the thirst. When there's too much water, the kidneys are trying to regulate that. So that's why we're urinating, right? We always want to maintain homeostasis. All right, we're going to stop here and we will continue in a little bit.